Hi, I'm Alicia Stromberg.
I'm Emma.
I'm Aaron Chang.
Sakshi Desadula.
Dr. Leslie Heilig.
Erica McKibben.
Chris Noble, and I'm the organizing co-lead with.
I'm the communications coordinator.
I'm a state captain.
Fundraising team.
Community organizing director.
Policy team.
State captain for the Right to Health Action.
Beginning of the pandemic, I was seeing the disastrous policy response and how many lives it was costing. I also worked on front lines of COVID testing during the December-January 2020 peak.
Lost my father, George Edward McKibben, April the 7th, 2020 to COVID-19. He did fight a long, hard battle. It was hard for my family because we could not go see him. We did do FaceTimes and things like that. Unfortunately, I was sick at the same time, and the hardest part was we had to sit outside 6 feet apart, being reminded by the law enforcement on site at the hospital, knowing that my dad was inside fighting for his life. 2 hours later, I got the call he passed. I couldn't see him and be with him at all. So the last time I saw my father was March the 8th, 2020. I don't want any more families to go through what my family went through. They shouldn't have to. And I truly, truly believe his death could have been prevented.
I have seen my family and community devastated by this pandemic, and I advocate with my peers to demand that our government do more.
As a public health scientist, I know we could have done more to plan and prepare for this pandemic, and our lack of doing so has resulted in millions of preventable deaths. We started in the midst of a pandemic as a small group of people that were united in anger and dedicated to ensuring that a public health catastrophe like this never happens again.
COVID-19 shouldn't have ever happened. We have the resources and knowledge to prevent pandemics, but we are lacking the political will to end this deadly cycle. Without change, more pandemics are coming, and sooner rather than later.
And that's where Right to Health Action comes in. We're organizing to stop this current crisis, to build back better, and to prevent pandemics of the future.
By centering public health equity and environmental justice policies. Our vision resonated with the nation. We have grown to tens of thousands of activists, scientists, health workers, students and young people, policy workers, global health veterans, COVID-19 survivors.
And people like me who have lost their loved ones to this pandemic, people who we will never forget.
We make it a point to connect with and empower people who have real experiences of loss and hardship caused by the pandemic, and who want to put truth to power by sharing their personal stories with their legislators. We hit the ground running, and we're not stopping. We are nearly an all-volunteer leadership team of 50 people, activists from all around the country, and we've hosted over 1,000 meetings with members of Congress to educate and influence our policymakers.
We've trained a new generation of grassroots organizers in all 50 states to mobilize the public through real-world protests and digital bird-dogging events. Our high-profile virtual teach-ins and town halls have equipped over 5,000 people with tools to advocate for public health policies.
Our network sent over 362,000 letters to members of Congress via our digital actions. We did all of this in just a year and a half. In everything we do, we center the communities who have been most affected by the pandemic and by the systematic inequities that cause these cycles of injustice.
Universal health care and a new deal-sized public health jobs program to fight racial health disparities. Ensuring publicly funded vaccines and medicines are free for everyone and available everywhere. And stopping corporations whose irresponsible supply chains contribute major drivers of pandemics like deforestation and climate change. And we're making a huge difference. We've co-written and influenced 7 bills in Congress and led 2 congressional sign-on letters. Our letters centered around our platform, the People's Pandemic Prevention Plan, which garnered 141 signatures from members of Congress and over 450 co-sponsored organizations.
And we are winning. We're close to passing the biggest global health initiative in a generation. Our most recent legislation, the International Pandemic Preparedness COVID Relief Act of 2021, or Senate Bill 2297, just passed out of committee with bipartisan support. This bill has so much of what we've been fighting for since day one.
This pandemic is not waning, and neither are we. The longer our world leaders delay to take transformative measures needed to stop this crisis, we're just accepting more deaths and economic hardship disproportionately experienced by people who are poor, people of color, and the world's most marginalized populations. We will not stand for this. We're working towards building international coalitions with global health allies, empowering more young leaders with activism and organizing skills, and building out our nationwide state teams to put more pressure on Congress.
We are leveraging the catastrophe of COVID-19 to instill widespread changes across our society. And we have the opportunity to change the world now, but it's going to require all hands on deck to help us get there.
Will you join us?